ओम धम धन्वंतरे नमः। कर्पूरगौरम करुणावतारम संसारसारम भुजगेन्द्रहारम सदा वसंतम हृदयारविंदे भवम भवानी सहितं नमः. Let me talk on immunomodulators. Immunomodulators, the concept of immunomodulators and its utility in Rasayana therapy. We'll discuss something subject. So, Rasayana is a concept in Ayurveda, novel concept in Ayurveda. By Rasayana therapy, we can attain the Prashasta Dhatu, Prasadi Prashasta Dhatu. And there will be actions like walk, improvement of speech, increased lifespan, increased luster, and intellect, etc. are improved by the use of Rasayana. Rasayana acts by three means: acting on the rasa, acting on the agni, and acting on the frutas. So, acting on the rasa, which improves the quality of tissues. Acting of agni, which improves the metabolism, digestion and metabolism. Have the Rasayana action. And by improving the frutas, that means micro channels, they are clear and they are made more patent, and the micronutrition is promoted. Thereby, they are getting the Rasayana effect. The modulation of immune response by using Ayurvedic herbal medications as a possible therapeutic measure has now become a subject of scientific investigation. The concept of modern scientific understanding would mean enhancement of immunoresponsiveness of an organism against a pathogen by non-specifically activating the immune system using immunomodulatory agents of plant origin. It is now being recognized that modulation of immunological response will provide an alternative to conventional chemotherapy for a variety of disease conditions of impaired immune responsiveness, or when a selective immunosuppression has to be induced in situations like autoimmune disorders and organ transplantations. Immunomodulators are considered now as one of the most potent tools in the management of health and disease by modern medicine. In fact, the role of immunomodulators in modern medicine is yet to be fully appreciated or perceived, as our understanding of immune system is changing at a rapid pace. More recent advanced understanding of neuroendocrine immune axis, or the influence on exercise, circadian rhythms, seasonal variations, different psychological states on immune system are unfolding many such issues which are bringing the modern concept closer to Ayurvedic principles of Vyadhikshamatva, Ojas, and Bala. Basic concept of immunomodulation not only existed in Ayurveda but is being really practiced by the Ayurvedists for centuries. In fact, one of the therapeutic strategies in Ayurvedic medicine is to enhance the body's overall natural resistance to the disease-causing agent rather than directly neutralizing the agent itself. Here lies the difference between the fundamental therapeutic approach of Ayurveda and modern medicine, which emphasizes on direct attack on the disease-causing agents using chemotherapeutic drugs. In Ayurvedic practice, the objective of immune enhancement is achieved through the use of the Rasayana and Vachikarana therapy following Achara Rasayana measures, and also by the use of Bhojavartaka remedies. There are two terms Rojokshamatva, Yadhikshamatva, then Vyadhibala Pratibandhakatva, Vyadhi Virodhatva, and Vyadhibala Pratibandhakatva. Yadhikshamatva means immunity. Vyadhi, so Vyadhikshamatva. Then వ్యాధుత్పాదక ప్రతిబంధక, వ్యాధి క్షమత్వ, వ్యాధి బల విరోధత్వ. And వ్యాధి బల విరోధత్వ means antagonistic to the strength. And వ్యాధి బల ఉత్పాదక ప్రతిబంధక, capacity to inhibit and bind the causes and factors of the disease. Taraka has also described Bala as the factor that destroys the doshas of or disease causing factors. Balam Halam Doshaharam Nigrahaya Doshanam. Ojas prevents, resists, and overcomes such factors, which are produced in the course of the vital activities of the organism and may lead to decay and degeneration of tissues, of the body. Few examples of such events are Prameha, diabetes mellitus, and Ajakshma, pulmonary tuberculosis, Pandu, anemias, Arbudas, malignant and other tumors, immature senility, natural degenerative changes that take place in old age, impaired nutritional states, starvation, and such some psychosomatic stress conditions as bhaya, fear, krodha, anger, kama, libidinal impulse, shoka, grief, etc. This action of ojas relates to its capacity moving substances which resemble Shaishtika qualities, presence of which in the rasa and rakta confers adequate protection of the dhatus against decay and degeneration. The second important group of functions performed by ojas is to provide the body with an appropriate substance which inhibits, neutralizes, and destroys the virulent factors of the disease. These obviously relate to immunological factors, both cellular and humoral, that destroy or neutralizes the disease-causing agencies which invade the body. There are three terms again: Ojo Vyapak, Ojo Visamsa, and Ojakshay. They are the pathological conditions of Ojas. A new branch of medical sciences known as psychoneuroimmunology is fastly developing. It studies the interrelationship of psychological factors, nervous system, and immune system. Yadishamatva, is natural resistance, is not of the same order constitutions. That is, it varies with individuals. It also depends upon nutritional, environmental, and individual factors, both physical and mental. Radhishamatva or Bala is stated to be three types: Sahaja Bala, Kalaja Bala, and Utipaka Bala. So, use of Rasayanas and following Atar Rasayana, the Bala can be increased. Rasayana Tantra is one of the 8 clinical specialties of Ayurveda. It refers to nutrition, natural resistance, and geriatrics. Apparently, Rasayana means an improved state of nourishment, which in turn affords increased immunity and youthfulness. Rasayana can be a drug, diet, or even lifestyle and conduct. It is Achara, which may be helpful in achieving the above goal. So Rasayana acts by three modes: acting on the rasa, acting at the level of rasa, acting at the level of agni, acting at the level of sotas. So some of the rasayanas which have been subjected to scientific studies and found to possess immunomodulatory effect are ashwagandha, that is Videnia somnifera, Shilajatu, Amalaki, America, Officinalis, Tulasi, Ossimum sanctum, Uduchi, Dinospora, Cordifon, Pippali, Piperlum, and Pranava. graveyard refusal, of which Guduchi and Tulsi have been extensively studied. Yashtamadu, Lysizacabra, and another important Rasayana drug, has been found to be immunostimulative, which accelerates lymphocytic transformation, activation of macrophage, and increases the lymphocyte count. It also it has also it also have anti-allergic, anti-inflammatory, and antioxidant property. Control clinical study with combination of Rasayana drugs, Amalaki, Vidanga, and Atibala, and Amalaki compound has shown that in an increase in immunoglobulin levels in infant is significantly greater than that of multivitamin cases. A combination of four important Rasayana drugs, Guduchi, Shaganda, Amalaki, Tulasi, Nicolamons, was found to potentiate both cellular and humoral components of immunity. It significantly increased the microbicidal activity of the neutrophils and circulating levels of globulins and other components. It also significantly elevated the number of lymphocytes along with improvement in T cell memory. Macrophage function study showed a significant increase in cell size, number of cells, and phagocytic activity of macrophages with the administration of this combination. Chemotactic assay for phagocytic cell indicated positive chemotaxis for lymphocytes. The combination was found to potentiate the immune status and helped in faster recovery and used as an adjunct to specific therapy in cancer, chronic wasting diseases, multi-drug resistant tuberculosis, and other immunocompromised conditions. So Ayurveda's emphasis on the role of doshas and their imbalance as the main causative factor of the disease assumes importance in light of the fact that mere presence of positive organisms in the environment does not necessarily result in the manifestation of the disease. Concept of ojas and bala of inherent immunological capabilities, including innate immunity and acquired immunity in terms of sahaja bala and yukta bala, etc., playing key role in health and disease have to be understood and appreciated by modern immunologists. So today, we have discussed the immunomodulation and concept of immunomodulation and rasana therapy, its role in the rasana therapy. Ayurveda.